Citizens of the world, the Netherlands is slacking when it comes to containing the COVID-19 outbreak. Dutch China correspondent Leen Vervaken, who has seen the outbreak in Wuhan with her own eyes, has said to the Volkskrant, the newspaper that she works for, that the Dutch government is not doing nearly enough to contain the virus. He says that it looks like the Dutch do not understand the severity of the situation. In China, they learned that if you don't act fast, the epidemic can spiral out of control in no time, but the Dutch are slacking big time. She continues, if you want to stop the virus from spreading, you have to track down and isolate all infected people and their close contacts. But in the Netherlands, housemates of an infected person are allowed to go outside and do grocery shopping, for example. In Wuhan, it showed very clearly that it's very hard not to get infected when you live with a confirmed COVID-19 patient. A woman from Wuhan who was infected lived together with her two nieces. She stayed in her room, her nieces placed food in front of the door, and tried everything possible to not get infected, but got infected nonetheless. This just shows how important it is that all the housemates of infected people stay inside the house at all times. She also says that in China, people who return from countries like Italy, Iran, and South Korea have to go in quarantine for 2 weeks. Chinese have the better be safe than sorry attitude. In the Netherlands, you are only asked to self-isolate at home when you show symptoms. Even medical workers that return from infected areas are allowed to keep working if they don't show symptoms. It has been proven through multiple studies that infected people are already contagious in asymptomatic phase. I agree with everything she says in this article. The Dutch are not doing anything at all to stop the virus from spreading. Most citizens don't even care about the virus. They think it's just another flu that won't harm them. They are so wrong though. They are highly misinformed by the Dutch government. I'm afraid the Dutch government won't take any action until it's too late, and even then, they still might not go in full lockdown because they will think it's too drastic. The situation in the Netherlands is going to get really bad when the maximum capacity in hospitals is reached. Today we saw 121 new infections. New infections doubled. Yesterday we had 61 new infections. Total number of infections is now 503. Like I said in my previous video, the virus is growing exponentially. It's infecting more and more people every day, and it will only go faster if draconian measures are not being taken. With the virus growing exponentially, the reality of hospitals reaching their maximum capacity is going to be much sooner than we think. Italy reported more than 2,000 new confirmed cases and 196 new deaths today. The total number of recovered patients is now 1,045. This brings the case fatality rate to a staggering 44%. Dutch authorities are misinforming the public. Here are some examples. COVID-19 does not spread asymptomatically, but it does. Studies have shown it does spread during asymptomatic phase. Of course, it's true that when a sick person starts showing more severe symptoms, it gets easier to infect others, but it doesn't mean they don't infect others while not showing any symptoms. A recent German study even shows that in a very early stage of the infection, people are most contagious. COVID-19 survives outside the human body for only a short time. This is completely false. Study shows human coronaviruses can survive on inanimate surfaces like metal, glass, and plastic for up to 9 days. To disinfect contaminated surfaces, you should use 62 to 71% ethanol. Dutch authorities are convinced we can stop the virus from spreading if all Dutch citizens just stop shaking hands and wash their hands more often. I mean, really? Only draconian measures will contain the virus. Housemates of infected COVID-19 patients can go outside to do grocery shopping, but they have to make sure they stay at a distance from others and do not make physical contact. So wrong. The virus is super contagious, and living with a COVID-19 patient is almost a certainty that you will get infected. When housemates leave the house, the chances of them infecting others is very, very real. Stay home. Protective masks are only recommended for medical personnel. But why? They work for everyone, everywhere. The virus can spread everywhere: schools, supermarkets, movie theaters. The virus doesn't care. Wear your respirator masks to protect yourself and others. By wearing a mask, you reduce the chance of getting infected yourself, which means you are helping to slow down the spread of the virus. So far, there is no evidence that the virus can stay airborne for a long time and can spread in this manner. Wrong. There are reports of aerosol transmissions coming out of China. Chinese authorities have confirmed it can spread through the air. The virus can stay in the air for at least 30 minutes in an enclosed space. So let's say, for example, that an infected person was just in a store. You go to that store 10 minutes after the infected person was there. Virus particles are floating in the air in the store. You breathe them in, you get infected. The current stance and the strategy on containing the virus by the Dutch government is doomed to fail. They focus too much on panic management and do everything to keep the economy going. Or they are going to take real appropriate action, it's already too late. Hospitals will get overwhelmed and there won't be any chance left to contain the virus. They are running on wrong data and are misinforming the public. My advice to Dutch citizens: prepare for the worst case scenario. We are going to be in the same boat as Italy. As of today, the World Health Organization has finally declared the COVID-19 outbreak to be a pandemic.
WHO has been assessing this outbreak around the clock, and we're deeply concerned both by the alarming levels of spread and severity and by the alarming levels of inaction. We have therefore made the assessment that COVID-19 can be characterized as a pandemic. Pandemic is not a word to use lightly or carelessly. It's a word that, if misused, can cause unreasonable fear or unjustified acceptance that the fight is over, leading to unnecessary suffering and death. Describing the situation as a pandemic does not change WHO's assessment of the threat posed by the virus. It doesn't change what WHO is doing, and it doesn't change what countries should do. In areas with community spread, testing every suspected case and tracing their contacts becomes more challenging. Action must be taken to prevent transmission at the community level, to reduce the epidemic to manageable clusters. Depending on their context, countries with community transmission could consider closing schools, cancelling mass gatherings, and other measures to reduce exposure.
Reporting to you from Amsterdam. Give this video a thumbs up, subscribe to the channel, stay safe, and see you next time.